Everybody, we are live here at NAMI, Tennessee. All right, now you have a couple of minutes before we get completely started because Commissioner Williams is running a few minutes late, but that's okay because I have Executive Director Jeff Layden. But before we get to all of that, we have the standard opening words. Please join NAMI Tennessee's email list so that you can find out about cool things, well, like this. They also have curated content, stuff about the NAMI walks, just everything that is going on at NAMI Tennessee, and trust me, you don't want to miss a thing. All right, I think Jeff is ready to hop on in. I can tell that he's getting antsy, and that's okay because we like Jeff. Jeff!
Gabe Howard.
Hey, on one hand, I'm excited to see you, but of course, on the other hand, I mean, you're just a poor substitute for Commissioner Williams. So thanks for jumping in and holding down the fort. She just has a quick emergency that she's clearing up, and then she said she'd be here in about 5 or 6 minutes. But Jeff, welcome.
Well, thank you, Gabe. And I wanted to be sure that people that tune in at 2 o'clock looking for Commissioner Williams know that they should hang around a bit. And I thought that we would tell some stories or sing or dance or some of that, but not really. I'll take a minute first. That we love Commissioner Williams because she really likes to take the time to listen, and she partners with NAMI, the department does, and we value that. We appreciate that, and we can tell her what we like, and we can also tell her if there's some things that we think could be better, and she allows that as well. And so that's really important, and so we appreciate the partnership. But I'm going to take a couple minutes in the meantime and tell you there's 2 things coming up, really 3 things, all part of May. So here we are in March, and it's getting warmer, and I see flowers on the trees, and I saw a bee. So that tells me that it's spring. In Ohio, I don't know if you've got anything green yet or not. Do you, Gabe?
We very, very little. I mean, I guess it's a little green. Look, I got a window. I mean, it's kind of greenish, but as you can see, there's also a lot of not green.
Well, those trees look kind of lonely, but we've been seeing like the daisies come up. But anyhow, it's March now, but May will be here before we know it. And May is Mental Health Month. So that's a very special thing. And there's a couple of items I'd like you to know about. One is that NAMI Tennessee is doing a statewide NAMI Walk, NAMI Walks Tennessee, which is virtual this year, meaning you can walk wherever you are. And we're very excited about it. We think that it's a great way to raise awareness about mental health conditions. It's just really important. And we hope that people will get involved, that they will come out, they'll have a team, that they'll get some visibility in their communities. We've had people holding signs. We've had people walking for loved ones that they've lost. We've had people talk. We have videos during the day. We share what you're doing. We have mental health information and mental health awareness. With the pandemic, it's more important than it ever was to let people know that mental health conditions can be treated, that stigma is not needed, that your voice matters, that you can help. NAMI Tennessee allows people to get involved to help without having to have a degree as a psychologist or psychiatrist or nurse practitioner or case manager. It doesn't have to be your job. You can help different ways. We have people teach classes. We have people make presentations in schools to community groups. So pay attention to that if you're interested in working to make things better. And that promotes recovery as well. We learned this from Alcoholics Anonymous, AA. People that began in AA find that helping others helps them to stay sober. And NAMI has borrowed that because it worked, because it's powerful.
And of course, you can learn about all of these things. I'm just going to interrupt you for 2 shakes of a lamb's tail. You can learn all about this by signing up for the email list. See?
Thank you.
See what I did there? All right, Jeff, carry on.
Second thing is in May, we have the Vision of Hope Gala. And the Vision of Hope Gala traditionally has been a very expensive dinner. where we honor people that have made really large contributions to the world of mental health in Tennessee. Naomi Judd is a prior winner. Commissioner Varney, who was commissioner before Marie Williams, was honored. Judge Dan Eisenstein had been a longtime mental health court judge. Sheriff Hall in Nashville, who's brought mental health treatment into the jail, which is really important. Clark Flatt from the Jason Foundation. This is just some of the honorees. And the difference this year is it's virtual, which means that it will be much, much, much more affordable. Really, anybody will be able to afford it. So we have the Vision of Hope Gala, and it will have some very special things, and that's on May 11th. And if you are involved with a business that likes sponsorships, there will be sponsor opportunities. There'll be a silent auction through May, because all of what we do for free, such as these weekly Facebook Live programs. It's for free. The information's right there. And Gabe can tell you, since he's been the host, and we really enjoy him as host, what are some of the things we've talked about? So you'll have an idea. And by the time we finish with that, I think we'll be just about ready for Commissioner Williams.
We've covered such a huge array. Sincerely, Jeff. I mean, we've talked to doctors, we've talked to experts, we've talked to peers, we've talked to police officers. Jeff and I have bantered back and forth about what we learned in 2020 during the pandemic and what we hope is going to happen in 2021. And all of this, of course, is centered around mental health. It's all very NAMI based. What I really like about it is that it's not one thing. You know, it's not a show about anxiety. It's not just a show about serious and persistent mental illness. It's not just a show about NAMI classes. It encompasses so many things and such an incredibly wide variety of people. I really strongly feel that there has been a show that speaks directly to everybody, especially since we've been doing it for so long. And while live is awesome because you can ask questions, and when we mess up, you just don't know. Or I mean, when we mess up, we can't fix it, and they're also live forever. You know, that's the nice thing about Facebook. All of these are available online, and you're probably thinking to yourself, how can I get to them? Well, one, they're on the Facebook page under video. But if you want like a convenient link, you could sign up for NAMI's email list, and there's a little link there that says, click here for previous NAMI at-home Facebook Lives, and you can get there. Now, I just got word from Commissioner Williams' people that she's about 2-3 minutes out, so we are very, very close. And I have a very important question for you, Jeff, while you're here. Are you going to stick around and help me interview Commissioner Williams? I mean, you're here, your camera ready. I know you have questions.
I'll be waving goodbye when Commissioner Williams comes, because I really want her to have the stage as much as possible, and for people that are viewing to have the opportunity to ask her questions, that she really wants to listen and is working to make things better for people that are impacted by mental illness. And I really like that she's so well respected by our governor and our legislators, because when I talk about mental health, they mention the commissioner, that we have a champion. And if you don't get to see her, you may not know, what the state does really to help make a difference in people's lives. And so I'd like her to have the stage just as much as possible. And Gabe, you're a veteran. And let's just take another few moments while we wait for her. This is not the only time that people can see you. Why don't you go ahead and give yourself a commercial as well?
That's super sweet.
Our guest will be here very shortly.
Well, I am the host of the Inside Mental Health podcast, which is a Psych Central podcast owned by Healthline Media. It is a super awesome podcast. You can find it at psychcentral.com/show or your favorite podcast player. Just search for Inside Mental Health or search for Psych Central. It'll come up either way. And much like this show, it's a hodgepodge of everything: mental health, mental illness, and psychology. Everything from the lived experience all the way to, we've had the medical director for the National Institute of Mental Health. We've had Harvard researchers. We've learned about upcoming treatments that have worked. We've learned about past treatments that haven't worked. We try to cover everything. And if you're thinking to yourself, Gabe, I listened to that show and you have just never covered X. We even have an email address. Hit me up at show@psychcentral.com and say, nobody is covering XYZ. The most recent example of that is apparently in 4 years, I never covered borderline personality disorder. No idea how I missed it. It was not intentional, but I started getting emails saying, Gabe, can you cover borderline? And we did a 2-episode arc, one on what borderline personality disorder is. Then we did another one a few weeks later on the stigma that persists for people living with borderline personality disorder. So we really try to cover it as best we can. And I just got a little bleep in my ear. Commissioner Williams is in the green room. It's actually her office, but green room means something.
Thank you all. And
Jeff.
Thank you, Commissioner, for being here. Bye-bye.
All right. Bye, Jeff. Commissioner Williams.
Hey there, Gabe. How are you doing?
I am well. How are you?
I'm doing so well, and I apologize. We were dealing with the budget meeting. As you know, this is in the session of the legislature being in town. And based on that, a little bit of problems with my calendar. And then could not get connected. Finally got connected, and just really, really glad to be here with you all today.
Well, I am super glad you're here. One, because as the host, when you're not here, I just have to tap dance. Now, listen, I am really good at tap dancing, but I know that the audience would rather see you than me tap dancing. First, so everything's good. We got the budget worked out. Now, did you get $100 billion for mental health? Is that something that we can look forward to in the next budget?
We didn't get $100 billion, but I tell you what, we're getting up to $100 million. I mean, I'm serious. It is amazing the amount of funding coming in right now from the federal government, from our legislature, from the governor. I mean, it's amazing.
Do you feel that it's, these are always difficult questions to answer, so you can feel free to throw something at our head. But I know that the question that always persists out there is, we always need more. You have 50 million, you want 100 million, you get 100 million when it. So I know that people are listening and thinking, man, what is enough money to help all of our people? I know that your reputation is you'll keep fighting until you get every dime. Do you feel we're reaching the point that we're getting the right people on board to finally fully fund the mental health safety net in Tennessee?
Absolutely. I appreciate you asking that. I've got a, right now with me, can y'all see this? Because for whatever reason, I can't see what you're seeing. So can you see this?
I can see it, and I've made you nice and big, so hopefully everybody can too.
Yeah, and I can't see me, so I don't know what's going on. Anyway, so you can see this. That's most important to me. This is a big deal because we've been on target to meet this need right here. If you look at prevalence data in the state of Tennessee, you'll see that there's almost 400,000 Tennesseans that have severe mental illness. And Gabe, that goes into the line of schizophrenia, major depression, major anxiety, those type of illnesses. And what we did in the department that I'm so proud of, we did a chart to show who is covering who's funding what. So what you'll see here is that about 202,000, almost 50% of those individuals are privately insured. And so the private market is what's working to give them services. You'll see that about 34% of those individuals are covered either through TennCare, Medicare, or some other type of public market. But then, Gabe, what I really, really love is this box right here. It's about 12% of the individuals, that's around 44,000, have had no coverage, no way to get help. Up until several years back, the legislature passed funding for what's called the Behavioral Health Safety Net. And what I'm so proud to report, what I've been saying in our budget hearings is, to date, we have served 39,100 of those individuals through our public network of community behavioral health centers. 39,100 Tennesseans have gotten a full array of behavioral health safety net services, which means they can get care coordination like a case manager. They can get medication paid for with a small copay, really, really small copay. They can get individual therapy, group therapy. They can get individual placement supports. They can get any kind of intervention that is important for that person to be in recovery. So we're only off about 5,000, Gabe, and we're very, very grateful for that. That's a big deal. I've been in the field for over 30, well, it's 30 years this year. This is huge. We're 5,000 off. Now, one of the things, Gabe, that we've talked to the legislature about is this is prevalence data from the past. We know what's going to happen with COVID impacts related to anxiety, depression, substance addiction, that we're going to see higher numbers. So I want to relish in this right now with what we've got and where we've come, knowing, Gabe, that we're going to be updating that with new data that comes out of CMS. So thank you so much for asking about that.
You are very, very welcome. Now, your reputation precedes you. People know that you, I mean, one, you head up the department, the Tennessee Department of Mental Health and Substance Abuse Services. So clearly you're on our side. You're
absolutely on your side.
A huge cheerleader for us. And you've been a mental health advocate and a cheerleader for access to care services and allowing people to, in the words of the young folk, lead our best lives. Mm-hmm. And we love that. So my question for you is, how can we make more Commissioner Williams? How can we get more people to have your understanding of the needs of people with mental health issues and severe and persistent mental illness? Just because, you know, out in the community, some folks, and that includes our elected leaders, believe it's not that big of a problem, or you know, folks can just, you know, try harder or be med compliant, or and you know that that's not the case. How do we enlighten folks?
Well, Gabe, a couple of things I want to say about that and give you some background. Number one, my commitment and dedication and compassion and passion really starts back in Memphis when I started out as a case manager working with homeless individuals struggling with mental health and substance use issues. So I came up in the system, Gabe. I actually worked on the front lines in that mental health center. But the thing that really touched me and has informed why I love you guys so much is several people that were head of NAMI were very negative about the mental health center and how they were doing. And I've always been a person that says, go to the source and do everything you can to work out a solution. So people like Helen Adamo, Joyce Judge, June Palmer, Mickey Whitaker, those individuals became really, really good friends with me because I think they realized I was very sincere about what can we do to meet your concerns. I mean, that's where I started from. And I can't say enough about their impact. So when you talk about what can be done to change hearts and minds of citizens in our state, I will tell you, number one, Gabe, I've never heard as much support for funding mental health and funding substance addiction as I've heard from our legislature over the last 3 years. If you watch my budget hearings, you will hear people like Senator Watson, who's chair of the Finance Committee, which is a big role, talk about how, I mean, he said to his colleagues in our budget hearing, he said, you all need to know, if you don't already know, this is a huge issue. And COVID-19 has made it an even more huge issue. We need all the dollars we can to serve. And when you hear people like Chairperson Hazelwood, who's over the House committee, talk about what an important issue this is to make sure that we got dollars that go out to our providers. I mean, half the battle's won, Gabe. But if I were to say what could happen is if people will really reach out and tell their personal stories to the legislators And I mean, I really hope that you'll have positive stories about working with our safety net. And if there are stories where you haven't gotten what you needed, I always ask people, call me, call our staff with the actual details. Jeff will tell you, and I've loved working with Jeff over the years. He will tell you that that we respond when we get specifics. We don't do well when we get anecdotes, and anybody should understand that. It would be like, Dave, if somebody called you and said, there's all these people that are in need in Memphis and nobody's doing anything. Your first question is going to be, who are you talking about? If you really want to make a difference, you're going to say, give me the people's information. And so that's the first thing I'd say. Talk to your legislators, tell them what's working. And if something's not working and it's under our department, please call us and let us know, because we will get on it. The other thing is TennCare. You've got an incredible advocate with TennCare and Mary Shelton. She wants to know what the details are. And then obviously with private insurance, as Jeff and I have talked, the department that oversees that is Commerce and Insurance. So you would need to reach out to their department, and they do have contacts that can respond to the needs. So I hope that's helpful.
It's very helpful. NAMI believes very firmly that there's a lot of power in our stories. And we believe that there's safety in numbers. We believe in commiserating together. And it's hard sometimes when you think, so you're telling me that if I go to somebody in charge, and people in charge, our elected leaders can be scary to some of us, and I just tell them my personal story that's going to matter. Yeah. And yes, because stories need faces, problems need faces and names and understanding. Like you said, there's a whole bunch of people that need help in Memphis. That's so forgettable. Let me tell you about my brother. And you remember the person who told you, and you remember the story. And I really like how you said, be specific, be calm, be reasonable, be solutions focused. I do a lot of work with folks saying, okay, I know you're angry. Let's take a deep breath and put it into, something that can be acted upon. So I love hearing you say that.
Yeah, I'm glad you do that for sure.
So we have a question. It came up a little bit ago, so this is the downside of questions. Sometimes we talk about something else before I notice them. But the specific question is does that help that need detox MAT for substance abuse? We're back to the conversation about the budget when you were holding up the sign. So I won't explain it anymore because it's right there on the screen.
Right. The safety net talks about those that are struggling with mental health issues, right? So let me show you about those that are struggling with substance use. I'm so glad, Jen, that you asked about this. This is where I don't feel so good about what we're doing, and we are continuing to put as much funding as we can here. If you look at this same chart for Tennesseans struggling with substance use, what you'll see is our side. That again, when you look at our department, we're serving those that are uninsured or underinsured for the most part. We have programs that serve TennCare covered and private, but our main niche really is the uninsured or the underinsured. What you'll see there is that the population that is struggling with substance addiction that's in the prevalence data is right at 52,400. What I'm concerned about here is that our funding only allows us to serve around 20,000. So on my one slide for mental health, where I'm like, woohoo, we're like 5,000 away. On this slide, I'm like, man, I'm grateful for the almost 20,000 that got treatment, but we've got another 30,000 to go. So that's something I also talked about in my budget hearing. It's something that I know that the governor is very, very focused on himself. And it's something, if you look at where the funding's been going, you'll see that a lot of that's been going for that population. And so to answer your question about who is serving those for detox services in MAC, I would say to you, go on our website. It's really user-friendly. I believe Matthew Perriott might still be on here. He's my director of communications. He's the best director in the state. He has done a great job, he and Leslie Judson, who work with him, of making our website so user friendly where you can go on and Google where is an MAT or detox service in my community. So I hope that helps, Jen. Thank you for asking that question.
So one of the things that you mentioned is that you're not as excited about this side as you are about the other side, and that there's a gap to close. Now,
Right.
we know that you're fighting for us, and we appreciate that. How can we help you? How can the listeners, the watchers, and the NAMI family work with you to support you to close that gap? Because I know that's a goal of yours. It's a goal of ours.
Absolutely. Well, first off, you've got an incredible leader in Jeff Fladen. And Jeff goes out of his way to give me and our staff really great suggestions about things that could be funded through NAMI that could help meet that need. I can't say enough positive about him. So you got that covered, Gabe. The second thing that I would say is we know that our population is if you look at it, many people don't see it as a large block, right? If you look at our total population in Tennessee. So I've always been a big believer that if we're stronger together than apart. So again, if you would not complain until you've given us an opportunity to respond to your needs, you can complain if we don't do well or do right by y'all. But if you come to us and you give us the opportunity for those that we're covering services for to make a difference, it would mean so much if you did that. So your stories could be, hey, things are working well. Again, I'm not asking you to say they are if they're not. I'm asking you to come and let us know if they're not, so that we can address anybody's individual concerns with their family members. So that's what I'd say, Gabe.
Thank you. Thank you so much for that. And thank you for the question. And again, proving that Matthew is the greatest. He gave us the list. You can find a list of substance abuse treatment providers at this link. He dropped it in the comments section, and also I've popped it right up on the screen. So, and he has another great resource that he just popped up. So I
Right.
will leave that on while we move forward so anybody can write it down.
Thank you.
He is.
Way to go, Matthew.
Big round of applause. So one of the things that we're hearing about is 988. So the future for law enforcement and mental health, I know there's a lot of discussion both nationally and in Tennessee. We're hearing a lot about 988. Is this going to, how is this going to change things? What are your general thoughts on 988 and the future of law enforcement?
Thanks so much for asking about that. A couple things that you may not be aware of that is really important to know about 988. I've talked so much about how far ahead our state is compared to other states. And that is made so evident by 988 and what they're trying to do. Many states don't have a 24/7 hotline, crisis line. Many states don't have crisis stabilization units that cover the state. Many states don't have the ability to go out and do mobile 24/7 crisis intervention or telehealth. So one thing that's important to know is that 988 is trying to help. A lot of the funding coming through this is trying to help other states build an infrastructure that we have. We've got that infrastructure, which is amazing. Our hotline, crisis line, takes almost 120 something thousand calls a year. And those lines are manned and overseen by both TATIS, who oversees the substance use red line 24/7, and then our community behavioral health network that oversees the hotline for mental health. So again, context, Gabe, is we're just really doing great. Second thing about 988 as it relates to the future of law enforcement is what we're doing with CIT, crisis intervention. My work was in Memphis, and Randy DuPont was a big leader with that. And so I got to see firsthand with NAMI again, Helen Adamo, when I was in Memphis, what could be done with pairing law enforcement with people that have mental health training and how important that is. So we've already got that going. We can expand it. That's something that Jeff and I have been talking about. The third thing that we're doing that's really important in the state that 988 is trying to get done across other states is we have pre-arrest diversion programs. So many of our communities got funding to be able to have law enforcement work with a mental health provider for a person that's about to go into jail, get charged with something, to divert that person to treatment. That's been also amazing. Many, many people served. So that lets you know that. So 988, we have got a planning grant where we're bringing together all of the partners to talk through next steps in this state. And I believe NAMI's on that, Jeff's on that. They haven't set out any invitations yet because literally the planning grant just got awarded. But we'll be coming together to talk about in this state. Obviously, we got great infrastructure. How do we want to come together with the 988 line, which is really focused on suicide prevention, with what we already have in our crisis line, which many calls might focus on suicide or somebody wants to hurt someone else. Not a lot someone wanting to hurt someone else. It's really typically persons wanting to do something to themselves, which is really sad, which is why I'm glad we're here. But we will be working over the next year in this planning grant activity to see how we can dovetail those things together.
Commissioner Williams, thank you so much. I want to talk about something that's important to me, and I hope it's important to other folks as well. And it's certainly important to NAMI, and that's peer support.
Right.
Peer services it was sort of one of those things that I know as a peer we've been working on for decades.
Yeah.
But it's gained a lot of popularity in the last few years. So it's sort of one of those, I had to work for 20 years to become an overnight success. And
Yeah.
I know that a lot of people don't understand peer services, and I don't want to have a whole conversation about why it's important. What I do kind of want to address is that, why does the department invest in peer services? Is it a worthwhile investment? Why does the department like it? What is the department's thoughts on peer support and peer services?
We are 100% behind supporting peer services because it makes sense. I mean, it's common sense. If you're struggling with something and you want to get help, the person you're going to most listen to is somebody that's been there, somebody that's had that same experience. I mean, we're completely supportive of peer. We put peers in our hospitals across the state. We've asked for peers to be a part of crisis teams when people come to do crisis work. We have looked at peers throughout the community behavioral health and substance use system. We have expanded by leaps and bounds under Lisa Reagan, who is our head of our Director of Consumer Affairs Office. Leaps and bounds the number of certified peer specialists that we have in the community. They're vital to what we do.
I'm, as a peer, I am always fascinated that for peer support in mental health and addiction, if somebody says, hey, are you a new mother? Talk to other mothers and get some support and help. We know what you're going through. Everybody's like, that's such a great idea.
Right.
Are you new to sales? Oh, talk to the seasoned salespeople and get some ideas and learn how to network. Oh, that's such a great idea. Oh, do you have a mental illness and you're going to talk to somebody else with mental? That's such a terrible idea. Why would you do that? That's a bad idea. We don't believe. Weight Watchers is entirely on this concept of, and people are like, it's a genius idea. It's a $1 billion idea. I would like people to understand that more. And of course, we've seen with the research that is in fact how it works. And the last thing that I want to say on it is it has its place. I think that people think that peer services are somehow supposed to replace mental health workers. which like doctors and PhDs and therapists. And that really leads me to my next question, because there's a lot of talk in Tennessee. Are there enough providers? Are there enough mental health workers? And are they being paid a wage that makes more mental health workers want to go into the field?
Well, I'm so glad you asked that question. We have a workforce shortage in this state. We have it across all of the healthcare sectors. So it's not just behavioral health that there's a shortage, it's pretty much all healthcare. When you couple that with the paper that TAMHO put out, and I know Tatis is looking at this as well, with the wages that are being paid to starting mental health professionals, it's not good. It is something that I really believe that as a system, we need to come together and try to figure out some innovative ways to raise the rates to pay people. Now, what's a little bit what we're working through is, when you look back at that booklet thing that I showed you, that slide, there are three parties that fund the system, right? And so if you ask one party to fund it, but the other two don't, it puts that provider in a weird place, because they don't have enough funding to increase all of their staff, right?
Right.
So this is really something that's going to require a coming together. I can tell you that the TennCare director, Stephen Smith, this is something that he and I have talked about. There was a hearing that looked at this earlier this year. It is something that we're going to be continuing to look at, because, I've used the analogy, Gabe, if my doctor changed every 9 months, I'd be having a problem about that. And if you have turnover where you've got that person that's building those bridges and relationships with the person in need, and that's changing every 9 months, and I'm not saying that that's happening, I'm just giving an analogy, that's really hard. That's really hard. So, Gabe, let me ask you a question.
All right, that's fair.
How long have you been a peer and certified?
So I've been a certified peer supporter for about, oh man, I'm going to date myself, about 7 years.
Yeah.
And I live in Ohio. Please, my family lives in Tennessee, so we're good. But in Ohio, it changed about 6 years ago. So I became certified under the old model, and then that all wiped out, and I had to become certified under the new model. But here's the interesting thing that many people don't know: the new model was managed. I got the grant to manage and certify people, and I say the nonprofit that I was working for, but that was my job for the first 3 years of that grant. So my signature is on 3 years worth of certified peer recovery supporters in the state of Ohio, because me and my team were in charge of that. And it's fascinating work, and I want everybody to know that just because you live with a mental illness doesn't mean that you don't live in the real world and think some of those things. I think it gets lost. When I first heard people with mental illness are going to help other people with mental illness, the first thing that I thought, and this is a 100% true story, is you're letting the inmates run the asylum. That's the first thing that popped into my head. Now, luckily I had really good people around me, and it took them all of 5 minutes to convince me that often your knee-jerk reaction is not the best one, right? Your natural impulses often don't serve you well. This was the case for me, but I feel so positively about it, and I'm glad that states are starting to invest in it, because it saves a lot of time. And as you mentioned, there's a mental health worker shortage. So if somebody like me shows up in an emergency room who is suicidal, what are the odds that a therapist, a licensed social worker, a doctor, a PhD is going to sit with me for 4, 8, 12, 24 hours to make sure that I'm safe
Right.
in a shortage.
Right.
It's thank you so much for being on the front lines of this.
Absolutely. Thanks for sharing your story too.
Oh, thank you so much. We've got another question. I'm going to hit you with it. So one of the controversies, and I put controversies in air quotes. It's not a big controversy, but one of the controversies is funding for mental health awareness.
Yes.
Is it worth it when severe and persistent mental illness is obviously terrible. We've talked about, do we have enough money? There's the 5,000 people that need help, and it's really easy to put a critical eye on, okay, we invested in a parade. Is that important? So the two questions that I have for you is, who pays for mental health awareness? And assuming that the department does contribute, which I'm pretty sure you all do, is this a considerable portion of the budget? Is it taking away from people with severe and persistent mental illness? What are your thoughts on that?
Very, very great question, whoever asked that question. So one of the things that we look at is prevention, right? Because if you go upstream and you prevent severe mental illness and people struggling with that from deteriorating, not only do you help that individual, but you help that person's community, their family, etc. So mental health awareness is important to invest in as it relates to education and prevention of things deteriorating. We do fund mental health awareness activities through a variety of providers. I apologize, I don't know the actual percentage of that funding, but I can tell you that the largest portion of our funding really goes into treatment and intervention. We do fund prevention, education, mental health awareness. We fund aftercare and recovery and resiliency programs, but the bulk of our money is in that intervention and treatment. So I hope that answers your question.
It absolutely does answer the question. I know that it's very easy to become cynical, and I want to let people know that when I was first very, very sick and I thought, oh well, great, they're having a parade, like, how is this helping me? But I also want people to know that one of my first experiences feeling like somebody with bipolar disorder who was also normal was at an awareness event. It was an event outside. There was probably about 300 or 400 people there, and they were celebrating recovery. They were celebrating frankly, they were just acting like normal people. Kids were yelling, people were playing frisbee. There was a family in the corner arguing about, whether or not the potato salad is better by Aunt May or Grandma. It was normal, and all of us had this connection to either loving somebody with a mental illness or living with a mental illness. And when you're in that kind of environment for just a couple hours, it really recharges the batteries, and it makes you feel very, very normal. And now if you said, yeah, 80% of our budget goes to that, I'd be like, Commissioner Williams, what's wrong with you? But every budget that I've ever looked at, it's such a tiny percentage. I mean, a picnic just doesn't cost that much. These awareness events are not significant portions of the budget. And I'm sure if anybody emails you, you'd be happy to give them that exact percentage.
Absolutely, yeah.
Probably Matthew is already on it.
Again, I apologize. I didn't have that portion of our budget to speak to.
Oh no, that's quite all right. I just somebody wanted it addressed, and that's what we do here. Mm-hmm. All right, we got a couple. I'm trying to get this question out of the way and the next one up. All right. Again, thank you, Commissioner Williams, for being here and for being so candid and open with us. The next question is kind of a tough one. What do you say to the family member who wants their loved ones released? I'm assuming from like a state hospital or care, a committed care, because they are sick and we can care for them at home, and it got truncated, but the rest of it was, if they're sick, it's not fair that they're locked up. Right. So I know a very, very tough question, but I know one that you've probably been asked before.
Absolutely, and I know all the stats on that. We do our best to put ourselves in the shoes of both the person that's in our hospital system as well as their family. So what I'll tell you in our state, again, that I think is really wonderful, we have a two-part system. So in some states, they allow anybody to just say, hey, this person needs to be hospitalized, and they get hospitalized like a sheriff or a judge without any kind of professional assessing the person. I'm happy to tell you that in our state, we have two professionals before that person even gets into the hospital. So, two professionals, the person that does the assessment in the community has to say, we believe they're a danger to themselves or others. That's our criterion, Title 33. And then the admitting facility, so wherever that person comes to, you have a second professional that says, I believe they are in harm, a danger to themselves or others, therefore we need to admit them, and they do have a diagnosable severe mental illness. After that, what I want to say to you is that our average length of stay for acute, and that's people that are coming in acute, is less than 6 days. What that says is that the people we're serving, we're getting them where they need to go to be stabilized, and then being able to have them go back to the family again. It's average acute 6 days. Now, for those that are considered subacute and have been in our hospital for 3 months or more, that individual, all I can say to the family is to reach out to the CEO of our hospital. Again, you can get all this on our website. Reach out to the CEO where your person and loved one is, and ask them if you can schedule a meeting to discuss their case. If the person still meets commitment criteria, which means they're a danger to themselves or others, is determined by professional staff, we won't be able to release at that point. However, when they get to the point where they're not, and you as a family member say, hey, I can care for this loved one, I can make sure that they're getting medication and their follow-up therapy appointments. If you can make that case and talk to the CEO, then the odds of that being able to really impact that person's care is really, really high. I hope that answers your question.
It does.
Mhm.
It's fair to address that obviously it's traumatic. There's a lot of misinformation, there's a
Yeah.
lot of stigma, there's a lot of misunderstanding. And
Mhm.
I can only imagine getting a phone call that your loved one is sick or not with you and is
Right,
in a state facility. I,
right.
I can only imagine the oomph that would hit the chest, and I can understand why people react the way they do. And of course, it's important to understand that the reaction comes from a place of care and concern and fear and love for their family member.
Right,
So
right.
this sort of rolls into the next question. Does the state have services for, and services, very broad term, does it have
Mhm.
services, programs, support groups, information for the families? You've talked a lot about, what you can help do for peers,
Yeah,
people like me. How
yeah,
can you help my family get through this?
absolutely. Well, what I would say to you on that is that's why we fund NAMI. I mean, yeah, we got support. The best people to do this, in my opinion, are y'all. First, y'all. Secondly, we fund group therapy, which includes family therapy with our local providers. And so the safety net funds family group therapy. And please, again, that's why we keep saying to people, this is a great service. And if your loved one wants to do group therapy with you, that is something that's funded. So again, it's funded both through you guys and some of your other affiliate colleagues, and also to our providers, local providers.
Commissioner Williams, thank you so much. Question just popped in. Another controversial one, but I know, or I
Oh,
shouldn't say
that's fine.
controversial. Yeah,
That's
those are the most fun. I like to warn people before I hand over, questions that. And when I say controversial, what I really mean is just a topic or a question that is heavily debated. Right?
okay.
It's a shame that debate and controversy have now merged into the same word. But hang on, I'll kick my soapbox out from underneath me. The question specifically is, why do we have to wait until someone is essentially a danger to themselves or others before they can get mandatory treatment? I believe our laws need to be changed, and Georgia is apparently doing some good work in this area. Commissioner Williams.
There are many, many sides to that one. And you don't have to wait. So let me say this way. You don't have to wait till someone's suicidal or homicidal to get them help. Everything I'm talking to you about related to the safety net, if you've got a loved one that you know needs help, please call the local mental health center and say, hey, can I get them in? Um, that way, you don't wait until the person's suicidal or homicidal. So, we really are asking people to not wait for the crisis, try to intervene prior because there's a funding source for that. Then, as it relates to the actual laws around when a person is committed, um, that is something that our laws in the state, I believe, address really well for those that are in immediate care because you're taking the person's rights away. When you involuntarily commit a person, their rights are taken. And there are other alternative places to get treatment that may not be a hospital. Again, Gabe, I know there's a lot of different opinions on this. I've been a case manager, and I can tell you that the people that got better were those that came into care because there was a relationship that was developed. I remember one gentleman that was living under a bridge in Memphis, and he'd been living under there for 10 years, and I'd been told about him. And I went out and talked to him once a week for about 6 months. Um, there was no way anyone was going to mandate anything with him for treatment. I mean, he wouldn't have followed it, he would have left. Uh, but what I was so proud of, and there's so many stories. I mean, this is just one story. There are multiple stories of this with our colleague, community providers. After about 6 months, he said, tell me more about, what you do. Could I come look at it? When we brought him to the program and he looked at it, and after another 3 months, he was like, I'm really having problems with hearing voices. And that's part of why I stay under the bridge. And it was an amazing story, but it wasn't mandatory outpatient treatment, it was relationship. So again, I know there are differing opinions, and all I would say is please access the other services. If your loved one does not meet the criteria for inpatient hospitalization, look at our other things that we're funding, like the crisis stabilization unit. That's a 3 to 5 day stay to help people. So I hope that helps answer your question. Thank you so much for asking it. It's an important subject to talk about.
Oh, thank you so much, Commissioner Williams. Now we're running out of time. We have about 5 minutes left, and I want to make sure to give you the last word. So you have 4 minutes. No, in all seriousness, this is we wanted to give you an opportunity to just say whatever you want to say. I mean, the NAMI community is watching. This does go all over Tennessee, and I imagine that there's a lot of things that people ask you that we didn't think to ask you today. So you generally have a good, you have your finger on the pulse of what people in the mental health community are looking to understand and know. What do we need to know?
Well, the first thing you need to know is your worth. I have an acronym for NAMI that does not spell out NAMI the way y'all spell it out. It is an acronym that says notoriously awesome, magnificent individuals. NAMI. Notoriously awesome, magnificent individuals. So, what I would say to you is to know your worth. The second thing I'd say is that this chart really concerns me. And we're going to need all of y'all, in addition to everyone else that's in our system helping to make a difference. If you look at the indicators of anxiety or depression as far as prevalence, you'll see that during this pandemic, it's gone up to as high as 43% of the population self-reporting, which we know self-reporting typically is underreported. Self-reporting indicators of anxiety and depression. you and your story and your witness and your ability to refer people to help is needed more now than ever. I mean, that's almost 50% of our state. That's like 3.4 million individuals. Please know your worth. Please know that when you see people that are in need, you more than anyone else have the ability to really change the trajectory of that person's life and that family's life. And I just appreciate that you already do that. And then finally, what I would say is what y'all have been doing during the pandemic. I have told Jeff Layden more than once that weekly document that he publishes that gives all of these great tips. Gabe, you're in there. I mean,
The NAMI newsletter, it's right there, the email list right there.
and it comes out weekly, right? He's been doing it weekly with the pandemic.
Yep.
That is so wonderful. I have done the meditations. I have watched the videos for education. I just can't say enough. I hope all of y'all know how fortunate you are to have the NAMI staff you have, the leadership that you have. They are dedicated. They are caring. They are, I can't say enough about them. So I hope that all of y'all know that. So that's what I'd say, Gabe, as we close up.
Awesome. Commissioner Williams, thank you so very much for being here. Normally, I end the show by telling people to sign up for NAMI's Tennessee's email list. You took my thunder, so I might attend a budget meeting on your behalf just to kind of, balance things out.
Absolutely, Gabe.
Commissioner Williams, thank you so much for being here. There are, over on NAMI Tennessee's Facebook page in the comments section, tons and tons of links by Matthew, the communications director for Commissioner Williams, who we want to thank very, very much for being here. Those links are awesome. We've gotten a lot of comments like this one. I love our new acronym. Thank you for all you do, from Mary Sims.
That's awesome.
I will certainly remember it as well. It is awesome. Thank you.
I'm so glad Mary was on here. Hey, Mary Sims. Yeah.
Awesome. Well, thank you, everybody. I'm going to pop up the NAMI Tennessee email list link one more time. It's namitn.org. And remember, Commissioner Williams, she's like a state-appointed official from the governor, told you it's worth subscribing. I mean, that's like the greatest recommendation that we can ever have.
Well, Gabe, thank you. I'm going to sign off. Thanks so much to everybody, and hope you have a blessed day.
Thank you. Thank you so much. And we'll see everybody next week.
All right, bye-bye.
Bye, everybody.